Medigap Plan G, also known as Medicare Supplement Plan G, could be your solution to the 20% coinsurance rule that applies to some of those plans out there that you may be looking at, especially if you're turning 65 and you're just totally confused by all of the options that are out there. Okay, so what is this 20% solution? I'm going to talk about that. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, the first thing that you need to know is when you choose Original Medicare, you don't have any networks. Your referrals are not required. Pre-authorizations almost never come up. So basically, you and your doctor decide your care. So it's an unfettered access to health care without interference by an insurance company. Okay, so what does that have to do with Medicare supplement plans, Medigap plans, and this 20% factor that you're talking about? Okay, Medigap Plan G is the most popular plan out there, and it's currently offered by a number of carriers here in Georgia. What the 20% solution to the 20% factor is, 20% coinsurance is, if you get into a situation with outpatient health care, that would fall under Medicare Part B and Original Medicare, you could be responsible, if all you have is Original Medicare, you could be responsible for 20% of the cost of your outpatient care. If you're talking about something nominal like an office visit or something along those lines, we're not talking about a lot of money in most cases. But if you start to get into situations where you need to have chemotherapy, radiation therapy, even some high-priced cancer drugs and other medications as well, then you're responsible for 20% of the cost. That can add up because some of these treatments and so forth, even dialysis, for example, dialysis can be several hundred or several $1,000s. Radiation therapy, chemotherapy, several hundred, several $1,000s per trip. Okay, so you're talking about a lot of money. You don't want to get caught in a situation where you're responsible for 20% of the cost of something, some kind of test or procedure that runs $1,000 a month, or $1,000 per treatment or more. So Plan G can scoop in there and save you from having to pay that 20% because the Medigap Plan G, after you've satisfied your Part B deductible, pays the remaining 20% for you. Such a deal. So don't get caught up in one of these 20% coinsurance deals where you could have hundreds or $1,000s out of a pocket. Look at the Medigap Plan G. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.